I'm Szenan from Center of Balance, the acupuncturist. Well, today's topic, we're going to talk about acupressure point for UTI treatment. So it's more, everyone can do this point, right? It's easy to locate the point, and it's very, very simple, and there's literally no skill. Like you have trained for years to be able to do this. No, you don't have to train years to be able to do this. Learn this acupressure point and do this, perform this acupressure, apply this acupressure point for yourself. Right. It's going to be very, very simple. I'm going to show you just in a minute. I'm gonna so if you're on this live video, please give me a thumbs up and say hi to me. Then further on, I want you to do something for me as a favor. Please share this live video on your Facebook page, please. If you're on Facebook or if you're Instagram, please share and send this to your friends and your family who you think that they might they suffer from UTI and they've been on medications and that hasn't been helping. Or they get recurrent UTI and so painful. You heard a lot about this, and hey, guess what? This acupressure point is gonna help them to recover. Right? And it's very, very simple, very, very simple. Okay, let's have a look. Who's online now? Oops. I can see that. Hi, Eric. How are you? Hi, Veronica. How are you? Thank you for joining us. Thank you. Right. Let's start then. Okay. Now we know that to get rid of the symptoms, which is burning sensation, urgent urination, bleeding in the blood, in the urine, difficulty to empty the urine, and more importantly is burning, because those burning sensation and those pain sensation while you passing urine are very, very discomfort for you. Where about would they? They may over here, this area, or it can be in this area, and lower here. In Chinese medicine, we call Ba Liao area, sacrum, and lower abdominal over here. Wow. Now, if you're an acupuncturist, we talked about acupuncture point yesterday. If you haven't watched that video, we have a strategy for you, and that was on yesterday morning. That the live video, you should go and check on it, and it will be in your YouTube and Facebook as well. YouTube is the easier way to find all the existing video. Okay, now over here we got run meridian, stomach meridian, kidney meridian, and we talked about yesterday it may come to liver meridian and spleen meridian. So all meridian here. Now the simplest way in here is the image. We can use the image from here to here, right? Just in here, right? Or just in here. So the simplest way is go to here, halfway and halfway, and generally just do quarter. The quarter of your forearm close to your wrist, quarter of your forearm close to your ankle, and that's good enough. If you're patient, or show to your patient if you're an acupuncturist, that area, do the acupressure point. I'm going to show you how to do that in my arm. So in my arm, Okay. Here you go. This is my arm. Oops. Take tips. From here, halfway. Here, from here to here, halfway. Another halfway. That area. Right. Same as the leg. If you imagine this is your leg, your knee, your ankle. From knee to ankle, halfway, and halfway, and quarter close to your knee. So if your acupuncturist don't tell you, there is no need to tell your patient, hey, this is certain point and the function of this point. You can do that, but keep it easy, simple. Keep it simple for your patient, and this way I find is the most easy way to get to the sensitive point, and it will definitely help, right? So the technique is when we go to here, we use a knuckle, use a knuckle and press from here to here. You can start from the side, press over here. If you hit the sensitive point, keep it there and rub it for a few more seconds or up to 30 seconds, right? If you hit the point, up to 30 seconds. And once you finish this line, you move to closer to the center and keep going from there down to here and down to here. Now, how many lines can you follow? Could you follow over here? I always say 5 fingers in here. Each finger go down 1 line, 2 line, 3, 4, 5. Why is that? I know if you're an acupuncturist, we only have 3 meridian in here, but they are space between 2 meridian, right? So you don't want to miss any of the area, any of the point over here. So the simplest way is follow here, 1, 2, so very close together. You have line in there. So use a knuckle and press it and get to the sensitive point and work on it. When you get to the sensitive point, give it about 30 seconds. Rub for 30 seconds and then move to the next point and keep searching. Once you got a point, 30 seconds. That is how easy it is, right? So it can give you immediate relief from any sensation over here causing from UTI. Okay, now your aim is get rid of the sensitive point. And now the next question is you're gonna ask me, now so how often should I do that? All patients ask me this question. When I show them how often do I do that, I would say, hey, look at this. How often do you feel the pain, the discomfort? Well, they say, well, every second. All right, great. Now, as soon as you do that, you feel that they fade off. The sensation in here, the discomfort sensation, which is burning and pain, But the burning and pain is not just when you're passing your urine. It's something, if it stay in your lower abdomen, it's there all the time. You can feel it's in there all the time. So you press all those points, it went away. It definitely went away. Try a lot of time. It went away. Now while you're sitting there, if you sit in front of a computer, this is how you work, and you start to feel it came back again. Do it again. And while you're tapping, it came back again. Do it again. Constantly, when you feel it, you do it. When you feel it, and you do it. That is how often you should do it. That's one of the strategies. Now, if you don't feel it, the result is phenomenal, pretty good. You do it once, it went away, it didn't come back. Does it mean that you fix it? No, not that quick, because we're not giving you antibiotics. We are trying to increase your immune system. So with your own immune system increase better, it will fight with the bacterial, virus, and fungus. Does it make sense? So what happened is, if you didn't get any sensation after the acupressure point, here's my suggestion: do 3 times daily. Morning, afternoon, nighttime. Okay. Or another suggestion: some patients, they don't feel it, but as soon as they go to the toilet for urination, they start to feel it. And what do? Simple. Do it before you go to the toilet. So do the acupressure point before you go to the toilet. And you will find out that and actually when you go to the toilet, it's quite painful, burning, and you find it difficult to get empty the urine, right? So before you actually go to urinate, you do those points, and you went in the toilet, and you find, oh, okay, the symptoms gone, right? So it's so simple. You just have to apply those acupressure points. Now, everyone can use it. Everyone can apply it. It's so simple. So try it out and let me know. Send me a text, send me a video, and put it down there and let me know that whether it helped you or not. If it doesn't, hey, I'm not saying that's 100%, but most of the most of the case, it'll help. Okay, it may just help you a little bit. That's great. Now, if you need help further, Chinese medicine, acupuncture will help you get rid of it. So, what do? Call us on 078467956 or send on a text Facebook message if you're one of our patients, if you're watching this live video. So send us a text message or PM us on Facebook or call us directly 078467956 and we'll help you we'll give you acupuncture and Chinese herb to get rid of your UTI. All right, stay awesome. And this is the day that I'm back to clinic and to see patient. Today is Tuesday, and I'll see you tomorrow. We're going to talk about how to prevent UTI. How to prevent UTI. All right, stay awesome. I'll see you tomorrow. Bye-bye. Hi, everyone.